It's great to see you all here. Well, welcome this evening. I am Joan Whitney, Healthy Gloucester Collaborative, and I'm so happy to see all of you here today to talk about the important ballot question coming up, question number 4 on Massachusetts, the consideration of legalization of marijuana. So we have a wonderful presentation here for you this evening, and you are going to be hearing from some wonderful speakers on our panel, but I guess I want to say right up front, don't sit back. Do you see the pencils on your tables right there? Okay, great, because while you'll hear from our panelists, the energy in the meeting in our gathering tonight is your questions and what you want to get out of this evening for yourselves and to share with others in the community. So we hope you will also be the ambassadors of this information for those who couldn't get here tonight, to spread the information that you do hear. How many of you do have questions you want to ask? Just out of curiosity. A lot of it? Great, good, because that's what this is all about. I would like to say that what we believe in is a community that really comes together to get good information and to be able to be as informed as possible. So I would like each of you now, if you would, just look to the person behind you or next to you and thank each other for being here tonight. Go ahead. It's wonderful. It's really wonderful. Thank you. This is the heart of community, and I will tell you that tonight it took many hands to bring this forum together, and I would like to give my sincere thanks to all the coalition partners in our coalition in Gloucester, and to our great partners across Cape Ann, Beverly, Ipswich, and Danvers, making this possible, and sponsors such as the Children's Mental Health Campaign and Illegal Women Voters, and the beautiful Beauport Hotel, giving us such a lovely location for our meeting tonight. I'd like to also recognize tonight we have our Gloucester Board of Health here this evening. We have city councilors and local leaders from Gloucester and our other partner communities. Thank you. Thank you for being here. And thank you to all in a group tonight. We have a wonderful age range from college-age students to older as myself, and a wonderful cross-section of our communities. So again, thank you for being here. And without a doubt, partnership matters, and there is no greater supporter of building an informed, connected community than our mayor, the city of Gloucester. It is my great pleasure and my distinct honor to introduce to you our mayor, Mayor Safathia Romeo-Taken.
Well, thank you, everyone. It's a great opportunity for the City of Gloucester to have people come out and we can have a discussion. And that's what we want in Gloucester. And I love the diversity of the culture in here, the diversity of the age group. And I loved that my Board of Health, and I see school nurses here, Val Gilman and Gloucester Collaborative. Thank you very much, Joan. Bringing this for the first time ever in Gloucester is something to be proactive. Let's ask questions. Shall we and shall we not? In no way, shape, or form is Gloucester making any decision for you. It's here to give you information, to ask the questions that you always wanted to be asked, and get your answers, hopefully, this evening of how you should vote. And this is what it's all about. It's just bringing information out to you. You make your own decision. But we might learn a lot from some of the information they have. I will not be staying. I've been 18 years in healthcare. I really, and half of this group already educated me with medicated marijuana and what it can and cannot do. So I am not going to be influencing anyone on anything. And I have my information and I know how I'm going to vote. So it's your decision how you should vote. But please, don't be afraid. If you think it's for you and if you think you want it to be legalized, if you think you want to do something, then ask. If someone says something and it says, well, no, it shouldn't because it's going to be addictive, ask. Don't be afraid, because that's what this is all about. Look, we have a full room. That means there's people here that want to educate. We don't want a blind vote. We want an educated vote. Thank you.
So in the spirit of everyone joining together, this is your forum, and we have an esteemed panel to give you some information. And again, as the mayor just mentioned, get your questions. You can either write them, or we'll be out in the audience getting the questions for you to stand up and get the information you need to vote in the most educated way possible. So I would like to introduce our moderator for the evening. We're just thrilled to have Deborah Becker, from our senior correspondent and host, WBUR. Deborah, come on up. Deborah has really had many years reporting, especially with a focus on issues of mental health, criminal justice, and education, and it also helps on producing and special reports at WBUR. And has received numerous awards for hosting newscasts from Associated Press, Corporation for Public Broadcasting, and United Press International. Deborah has completed a number of fellowships on addiction, mental health, juvenile justice, journalism, and the law. So we have a really lively pace for you for this panel discussion. So I'm with great joy, I'm handing it over to Deborah to lead us forward.
Okay. Thank you. Thank you very much. Uh-oh. I think that must mean I'm in charge. That's a little intimidating. Thanks to all of you for coming tonight. This is a really important ballot question, and I can tell by the turnout that you know it's complicated. It's not a simple question of should we just legalize recreational marijuana. You are concerned voters, and you want to know what the ramifications of that might mean before you cast your ballot, your vote. So I'm happy to see all of you here, and we will get into some of the complications of that. I'm going to talk to you a little bit about the logistics of tonight. We have two panelists. Each of them will spend 20 minutes presenting their sides, and we also have the June from the League of Women Voters, who will be discussing the ballot question itself. After that, we will open it up for questions, and you know that you do have paper on the table where you can submit a paper question if you would prefer not to ask it directly. But if you would like to ask a question, just raise your hand, and I will bring the mic over to the table so you can ask the question directly if you would prefer to do that. We need to be out of here by 7 o'clock, so we will try to do that as soon as we can. But I'm going to tell you a little bit about our panelists first. The first person that we'll hear from tonight is June Michaels. She is a member of the board and past president of the League of Women Voters of Cape Ann. She's also the fiscal policy specialist for the League of Women Voters in Massachusetts. So she reviews the legislation that the League is interested in supporting or opposing, and she asks questions: what is this going to cost? Who is going to pay for it? And she's going to present first on question 4. We should also say June is retired from being a budget manager at Harvard University, and she served for more than 20 years on the Rockport Finance Committee. So June will be presenting first. Then we will hear from Jeff Miron. He's a senior lecturer and director of undergraduate studies at Harvard. He's also the director of economic policy studies at the Cato Institute. His area of expertise is the economics of libertarianism, and he has written extensively on the economic case against drug prohibition. Also with us tonight is John Kelly. He is an associate professor of psychiatry and addiction at Harvard. He's also founder and director of the Recovery Research Institute at Mass General Hospital. He's the program director of the Addiction Recovery Management Service, or ARMS program at Mass General, and the associate director of the Center for Addiction Medicine at Mass General. So I'm sure we will have a lively discussion. And again, they will each present, and then we'll ask a couple of questions, and we'll open it up to you. And I do hope that you ask questions, because I think that, I hope my role here is as much moderator as referee, and I would like to hear what you want to know before you vote in November. So thank you very much. June is first.
Thank you, Deborah. I hope you all have seen this. Information for voters from the Secretary of State. There will be a test later. The test is called voting. I was asked by the Healthy Gloucester Collaborative to explain some of the legal language in question 4. Very simply, a yes vote will allow adults over 21 to grow, buy, and use limited quantities of marijuana and products such as marijuana cookies without criminal penalties. The goal is to control marijuana the way alcohol is controlled. Existing laws treat marijuana as a controlled substance with criminal penalties for non-medical use. New chapters are going to be added to Massachusetts laws to provide for the licensing, regulation, and taxation of marijuana. A no vote will make no change to the law, including no change to the recent permitting of medical marijuana. Please understand, you are not being asked for your opinion. Are you in favor of legalizing marijuana? You are being asked to vote a very specific proposal into law. I'm going to point out a few items in the text of the law and suggest questions for the other speakers. If I ask more of the pros than the cons, it is because the burden of proof is on them to justify that their proposal with this specific language should be voted into law at this time. The League of Women Voters has provided a handout explaining the somewhat lengthy process of getting a question onto the ballot. So the first question for the proponents is, why did they decide to go the ballot question route instead of lobbying the legislature to ask? In the information for voters, arguments in favor, the proponents, yes on 4, state that taxing marijuana will generate an estimated $100 million in annual revenue for state and local governments. On the same page, the Executive Office of Administration and Finance says revenues and expenditures are difficult to project due to the lack of reliable data. Massachusetts is new at this. However, a good question for opponents to ask is, how could regulation possibly cost more than present enforcement of criminal laws? The arguments in favor include marketing to minors is strictly prohibited. The law requires retailers to check the age of buyers and prohibits a marijuana establishment within 500 feet of a school. You might want to ask, how effective have similar measures been in keeping cigarettes and alcohol out of the hands of minors? Arguments against include ignores the deadly opioid epidemic and the impact legalized pot will have on overall drug use. We hear a lot about marijuana being a gateway drug, but can opponents provide any scientific studies which support this? What is it we are regulating? Hemp is defined as the plant of the genus cannabis or any part of the plant, whether growing or not, with a delta-9 tetrahydrocannabinol concentration that does not exceed 0.3% on a dry weight basis of any part of the plant. This is similar, but not identical, to the definition of marijuana as a controlled substance. But this is a problem with legislating by referendum. The voter is asked to make a yes-no decision without being presented with alternatives. We would like to know, what does this definition cover and what does it leave out? The law establishes a bipartisan Cannabis Control Commission appointed by the state treasurer, just like the Alcoholic Beverages Control Commission. However, this 3-member non-elected commission is to have sole regulatory authority over the conduct of the business of marijuana, which is more than the Alcoholic Beverage Control Commission has. Why? What does sole regulatory authority mean, and why should the Cannabis Commission have it? The 15-member Cannabis Advisory Board will include 6 members who represent public health and law enforcement, and 9 members who represent marijuana growing and selling. My first reaction in reading the list of members was, considering that marijuana has been illegal up to now, where are all these experts in marijuana cultivation and retailing to come from? But more seriously, is the advisory board weighted toward the industry? Should it be balanced better between business interests and the protection of the public? Taxing. The law creates a new excise tax of 3.75% on non-medical marijuana sales in addition to the state sales tax, with the proceeds going to a marijuana regulation fund. Local communities can also vote in a local sales tax of up to 2%. The legislature can appropriate money from the Marijuana Regulation Fund for the regulation of marijuana, and at year-end put the unspent balance back in the general fund. You do understand what this means. The legislature is not bound to spend all the tax proceeds on regulation of marijuana. Licensing of marijuana establishments. I could not tell from the definition of a marijuana retailer whether an existing grocery, pharmacy, or convenience store could obtain a license. So could marijuana be sold alongside products which children under 21 can legally buy? Local communities can restrict the number and location of marijuana facilities, but may not impose unreasonably impracticable regulations or limitations. Basically, they can't make the rules so strict that nobody could possibly ever qualify for a license. More on licensing. A prior conviction solely for a marijuana-related offense shall not disqualify an individual or otherwise affect eligibility for employment or licensure in connection with a marijuana establishment. Why is a prior marijuana conviction not a bar to obtaining a license? The law does not seem to distinguish between past convictions for possessing 1 ounce and past convictions for major trafficking. Child endangerment, and I'm almost done. Absent clear convincing evidence that the person's actions related to marijuana have created an unreasonable danger to the safety of a minor child, neither the presence of cannabinoid components or metabolites in a person's bodily fluids shall form the basis for denial of custody or other parental rights. A question for both proponents and opponents. Is there any medical standard for a blood cannabis level which renders someone too impaired to operate a motor vehicle or look after a child? This law goes into effect January 1st, 2018. A question for both sides. Is 1 year sufficient time to form a commission and get all the regulations in place? Finally, in political matters, it is always a good idea to follow the money. According to the Office of Campaign Finance, the proponents, Yes on 4, have spent $2.5 million in 2016 through mid-September. Opponents, mainly Safe Cannabis Massachusetts, Smart Approaches to Marijuana Action, and the Campaign for a Safe and Healthy Massachusetts, have spent a total of $126,000, or 1/20th. I will repeat the summary. A yes vote will create new laws to regulate marijuana for personal use, the way alcohol is currently regulated. A no vote will make no change to existing laws which permit only medical marijuana use.
Okay. Good afternoon. Thank you for coming. Thank you to everyone who put this together and for giving me the chance to talk about this topic. So you'll see as we go through that I'm not going to be especially focused on the details of question 4. I'm going to be talking more broadly about the arguments for legalizing marijuana. Some of the details specific to question 4 will come up, and we can get into some of that in the question and answer. But a lot of what I have to say is much broader than that. And indeed, in response to some of the questions that were just raised, if I had written question 4, it would look very different. It would not have some of the specific features that this particular ballot initiative has. Okay, so as you know, Massachusetts is considering legalization. Okay, we have already decriminalized marijuana in Massachusetts, which means that possession of a small amount, ounce or less, is no longer a criminal penalty. It's punishable only by, roughly speaking, a traffic fine. Okay, we have also legalized medical marijuana in Massachusetts. There are now, I believe, 8 dispensaries that are open, which can legally sell marijuana for people who have qualifying conditions and appropriate prescriptions. The issue we're talking about, the issue for question 4, is whether to fully legalize under state law, okay, so that people can purchase, consume, grow, distribute, etc., for purely recreational reasons. No doctor's prescription or anything like that is necessary or involved. Okay? And it's useful to note, more broadly than today's conversation, that question 4 would only affect the Massachusetts state law. Marijuana would still be illegal under the federal law, just as it's still illegal under the federal law in the 4 states that have already legalized: Colorado, Washington, Oregon, and Alaska. And that potentially creates very messy conflicts between federal and state government. Okay, but I won't get into that today unless maybe it comes up in the questions. Okay, it's also worth noting that, let's see if this works, 5 more states are considering legalization, okay, in November, in just about a month. Okay, California, in addition to Massachusetts, California, Arizona, Nevada, and Maine. So I want to talk about 4 issues related to the basic question: should marijuana be legal or outlawed? The 4 issues are the alleged harms from use, the potential benefits from use, okay, the impact that legalization might have on marijuana use and the outcomes related to use, both positive and negative outcomes, and then the side effects, mainly negative side effects, of the alternative to legalization, that is to prohibition. So people make many claims about how marijuana use leads to various adverse outcomes. It's bad for people's health, allegedly. It's bad for their productivity, their ability to get up and go to work, or their ability to do their jobs well at work. They worry about educational outcomes. They worry that marijuana use precipitates crime, okay, of various types. And in addition, that marijuana use leads to use of other drugs, harder drugs such as cocaine, heroin, and so on. So the message I want to convey is simply that these claims are between false and highly exaggerated. Okay? Now, I don't want to say that anything is completely safe. Tons and tons of things that we all do every day are not completely safe. Most of you drove here in a car. Driving a car is not completely safe. Many of you consume alcohol. Many of you ski on dangerous double black diamond, ski slopes not very far from here. Okay? People eat all sorts of foods which are potentially very bad for you, okay, if done in excess or if misused in various ways. And you could go on and on and on about all the zillions of products that exist in the world that are legal and have for the most part always been legal, and that can be and are very dangerous and that kill lots of people every year, such as automobiles. And yet all those products are legal. Okay? So I'm not saying that marijuana is completely safe, but if you compare its documented harms, its documented effects on people's income, its documented effects on tendency to commit crime, or any of the things on this slide, you will find that compared to an awful lot of things which have been legal for a long time, marijuana is incredibly safe, at least relatively speaking. So let me talk about just a couple specifics. Okay? On productivity, okay, there's a frequent allegation that people who use drugs, marijuana or other drugs, okay, end up not being able to hold jobs, they're less employable or less employed, that they have lower wages or incomes and things like that. The systematic studies which examine this find, in fact, that the marijuana users have higher incomes than people who are not users. Does that mean that the marijuana use caused them to have higher incomes? Probably not. It probably tells you that people with high income can afford marijuana. Okay? Or it tells you that there's really just some types of people who happen to be hardworking and creative or outgoing or whatever who happen to also consume marijuana. Okay? But that should make you very, very nervous about any of the standard claims that correlate marijuana use with allegedly bad or good outcomes, because there's a zillion reasons why those correlations don't tell you anything about the causal effects. Okay? To take a different example for a moment, okay, there have been allegations that marijuana causes crime back to Harry Anslinger, the head of the FBI in the 1930s. Okay? It's widely believed that that was based substantially, if not entirely, on racism. Mexicans were migrating to various U.S. states in the 1930s, and Mexicans were relatively heavy users of marijuana at that point compared to the native U.S. population. And so the association of crime and marijuana was simply a way to slander Mexican immigrants, to create more pressure against Mexican immigrants, and to make life less hospitable for Mexican immigrants, okay, by alleging that they, in fact, were involved with crime. There is no systematic data, no data of any kind that suggests marijuana use actually makes people criminogenic or anything like that. Causation is very much the reverse, from government policy to causing crime associated with drugs. I'll talk about that a little bit later. Okay, the next part, which I think personally is underemphasized by the advocates of legal marijuana, is to talk about the potential benefits from use. Now, that does get discussed in the medical marijuana framework, but it's frequently omitted when we're just talking about recreational marijuana. The fact is that tens of millions of people in the United States every year, okay, somewhat smaller numbers every month, use marijuana without any apparent negative side effects, okay, without causing serious negatives to anyone else. Okay. Of course, okay, sometimes things go wrong, but that's, as we said, true of zillions of other products. It suggests that these people, or at least most of these people who are using marijuana, perceive some benefit. People choose to consume marijuana because it helps them relax, because it alleviates their back pain, because they enjoy being intoxicated. Okay. In a free society, the burden of proof should be on the restriction, those who want to restrict freedom, those who want to say people cannot do something that they want to do as long as they're not harming other people. And so the fact that lots of people seem to enjoy using marijuana and perceive a benefit, okay, should at a I hate it when I do that. Should at a minimum be relevant to the discussion. We shouldn't dismiss the fact the key benefit of legalization is not the extra tax revenue or anything like that. It's the fact that by legalizing, we will allow people who want to use marijuana and who do so without harming others to be left alone to do what they want to do, the same way that people who consume alcohol or coffee or double black diamond ski slopes or anything else are left free to do what they would like to do as long as they're not harming anyone else. So now let's ask, okay, about some of the practical questions of what happens if you legalize marijuana. A standard assumption is that legalization will lead to some major increase in use of marijuana. Okay? So that's, of course, possible in principle. Okay? Marijuana prohibition creates penalties for being found in possession or purchasing marijuana. That may discourage some people. Prohibition leads to penalties for people who transport, sell, etc., grow marijuana. That, of course, tends to raise costs and should reduce the quantity of marijuana that's consumed. But the magnitude of that is an empirical question. Okay? Whether prohibition raises costs of producing marijuana a lot, whether the penalties have a significant effect, okay, in discouraging people from purchasing and using, is an empirical question. Okay? And there is no existing evidence that suggests a big effect. There are many, many studies of this, and there are many studies of similar questions, such as whether U.S. alcohol prohibition or other examples of alcohol or drug prohibition had major effects on consumption of the prohibited drug. None of them finds a big effect, and a very large fraction find essentially no effect. Okay? So to take specific examples that are highly relevant here, in this context, Colorado and Washington have legalized marijuana now almost 4 years ago. 2 other states have done so 2 years ago. There's not really quite enough time to even get much data from those 2 states. And in a paper that I recently published with some co-authors, we examined what happened to marijuana use, drug use, alcohol use, and so on in Colorado and Washington as a result of their legalizations. And the answer is really simple. Not much. Okay? Relative to the pre-existing trends and patterns, there was essentially no detectable change in what happened to marijuana use. There's no obvious reason why one shouldn't expect exactly the same thing in Massachusetts. Now, from my perspective, okay, that is not the only thing that's relevant. That's not necessary to support legalization, because I don't think we should be trying to keep people from consuming marijuana. Okay? In fact, we're harming people who want to consume it by preventing them from consuming. But if you are concerned about that, the evidence is that the policy of prohibition has almost no effect in reducing use. Now, there are a whole bunch of other outcomes that people are concerned about. Okay, other drug and alcohol use, as I mentioned. Well, I definitely am not doing well with this today. Traffic fatalities, crime, educational outcomes, and so on and so forth are things that people are worried about as a result of the possibility of increased marijuana use, et cetera. Now, if marijuana use didn't go up in any of these other states that legalized, didn't go up in Portugal when they legalized marijuana, didn't go up in Amsterdam when they legalized, and so on and so forth, then you wouldn't expect things that are allegedly due to marijuana use to go up, because use doesn't seem to go up, at least not very much. Okay? But it's nevertheless interesting to look at those things. Okay, we're just going to have to deal with it this way. Deal with those things separately. So the paper that I just mentioned, the research, okay, that I've done and that lots of other people have done on what happened in Colorado, Washington, et cetera, on crime, on traffic fatalities, public health measures such as suicides, educational outcomes, economic outcomes, criminal justice expenditure, tax revenues. Okay, set aside tax revenues for a moment. On all these other things, the summary is very simple. No statistically meaningful, no noticeable effects, okay, of marijuana legalization. Okay, so whatever you think about marijuana, good, bad, or indifferent, if the policy doesn't change the use of it very much, then from that perspective, you should not be very concerned. Okay, now, if there were no change in use and no change in those outcomes, you might say, well, then why do we care whether we have prohibition or legalization? We should care because prohibition generates lots of costs. Okay? Potentially, prohibition leads to much more crime and violence. Why? Because prohibition creates underground markets. In underground markets, people resolve disputes with guns instead of with lawyers and arbitration and courts. It generates corruption because now the people in a particular industry have a strong incentive to bribe police, judges, et cetera, to look the other way when these transactions occur. Prohibition is incredibly awful from a civil liberties perspective, from a racial justice perspective, because prohibition laws for a victimless crime are inevitably enforced very racially differentially. That's why jails are full of people who are African American, Hispanic, even though use rates for marijuana and other drugs seem to be essentially the same for people of different races. More people end up accidentally getting poisoned and have negative health effects from consuming drugs in an illegal market because you don't have good quality control in an illegal market. You don't know whether the marijuana has a high THC content or a low THC content, and so on and so forth. You can't do medical research because the prohibition framework makes it extremely hard to do research on marijuana. Under that circumstance, you expend huge amounts of criminal justice resources, you disrupt other countries like Afghanistan, Colombia, Peru in the attempt to enforce prohibition. So prohibition has really awful negative effects. So unless you think that prohibition is preventing a lot of use, and it's preventing use which would have been really harmful use to someone, then it's absolutely unambiguous that legalization is better than prohibition. Now, I should emphasize that it says here potentially. Because at this point in the United States, the best way to think about it is that marijuana prohibition has roughly been in abeyance. It still exists on the books, federally and most states, but in practice, marijuana prohibition is not being very well enforced, which means that a lot of these things are no longer happening to a significant degree. They're happening to a small degree. And that's part of why we shouldn't expect much change at all if we formally legalize marijuana, because we already have gone an awfully long ways to de facto legalizing marijuana. Nevertheless, there still are some benefits. Governments will be able to collect the tax revenue, not huge amounts, but not completely trivial amounts. And the people who want to consume marijuana will be able to do so in peace and quiet, not with the possible risk, admittedly small, but nevertheless the risk that you get arrested, hassled, whatever, okay, as a result of engaging in something which is not hurting other people. Okay, so to summarize, I would certainly accept that reasonable people can make an argument for why policy might want to discourage some aspects of use of marijuana or alcohol or tobacco or other drugs under a legalized system. Age restrictions, time and place of use restrictions, etc. Okay? But outlawing marijuana is inconsistent with any reasonable balance of the costs and benefits of possible negatives that sometimes occur from marijuana use versus all the negatives that occur with policy. Okay? Therefore, we're much better off having a legal regime and possibly appropriate taxes and regulation around that, okay, so that everyone transacts marijuana in a legal market. Thank you very much. Hi. Okay, let me get my slides up. Good evening. I'm John Kelly. Great to be here. Thank you for having me. Thanks for the invitation, and thank you all for coming. It's great to be part of this. Thank you, Joan Whitney, for pulling us all together here and organizing it, and all the drug prevention coalitions who are participating. It's an honor to be here and talk about this very important topic of legalization of marijuana. So Henry L. Mencken said a while ago, for every complex problem, there is a solution that is clear, simple, and wrong. A clever statement, amusing, but also true, I think. Whenever you hear someone say, with regards to a complex problem like a drug problem that we have in society, all you got to do is fill in the blank, you know they haven't really thought very much about the nature and complexity of drug policy. So these are the questions, of course, that we're thinking about tonight. And on the ballot, question 4 is, as Jeff has already said, why should marijuana be illegal? And why should it be legalized? And what problems does marijuana legalization solve? And what new problems, if any, might be created through marijuana legalization? This is a helpful graph, I think, to understand different nuances or impacts of drug policy. Is this the clicker here? Okay, great. So you can see these are social health and social harms up this side of the graph. And these are different policy positions across here, so ranging from prohibition to decriminalization, to market regulation, to prescription, to legalizing with many restrictions, to legalizing with few restrictions. And what you see is this inverted, this U-shaped graph, which shows kind of the negative consequences of prohibition, which include gangsterism, black markets, cartels, etc., which causes high degrees of social harm and health harms. But interestingly, we also see with unmitigated commercialization also high social and health harms. They're just a different shape and a different nature. So one of my colleagues in the policy world has said, it's not so much are we going to eradicate our problems, but which problems do you want to have? So we may change the shape of the nature of the problems by eradicating the black market, but what new problems might we create via a commercial policy of legalization? Now, there are, of course, sweet spots here depicted in terms of increasing or decreasing the public health or health and social problems associated with the drug problem, which include decriminalization, market regulation,
and legalizing actually with many restrictions. So there could be a way even of legalizing without commercialization that would reduce the overall health harms and social harms that would be incurred, and also eradicating the black market. So what is marijuana? It's the common ingredient in cannabis sativa. It's otherwise known as cannabis sativa. It's the active psychoactive ingredient is THC. It's most commonly inhaled, of course, through the lungs. It produces mild euphoria, mood enhancement, relaxation. Higher regular use produces intoxication, slowed cognition and memory impairment, including short-term memory and working memory, and also increases anxiety, paranoia, psychosis, produces hallucinations in high doses, and causes addiction. It can increase the likelihood of accidents through intoxication, but mortality, direct mortality as a function of exposure is very low. And it may be neurotoxic in higher doses, and in particular, it looks like teenage brains are particularly vulnerable to the negative impacts of exposure to marijuana. It's popular, of course, around the world. It's the second most popular drug after alcohol. Popular in the US. How did we get here to this point of legalization with cannabis? Well, it came really through, I think, through the pathway of medical marijuana. But this is the legality. Jeff's already mentioned the states that have already legalized, including DC. And you can see these are the medical marijuana states, the light green, dark green of legalized, and then illegal use. Okay, so medical marijuana seems to be a universal panacea for curing all kinds of, or helping with all kinds of conditions. It's somewhat remarkable to me that it's actually passed into law via popular vote and not via science in terms of it's not prescribed, by the way, it's recommended. A physician will make a recommendation, but it's not actually a prescription. But according to proponents, there's about 259 conditions that medical marijuana will help with. There's only 117 known medical conditions, so I was a little suspicious when I first saw this. But certainly it seems that, and we know that there are medicinal properties inherent within marijuana, within cannabis, the cannabis plant. And in fact, there have been FDA-approved medications based on the psychoactive ingredients of marijuana, THC and cannabidiol. And it looks like there may be a third one, which is looking good, called nabiximols or Sativex, which again has therapeutic properties that can help people with a variety of different ailments, particularly with people who suffer from cancer and cancer treatments for pain and multiple sclerosis spasticity. One of the issues with smoked marijuana, the literature on smoked marijuana, which of course is what medical marijuana is very weak. We don't have strong evidence of actual how smoked marijuana has therapeutic properties. We don't know what the dosing should be, what the amount should be, whether pregnant women should smoke it, etc. We don't know any of those things. We also, from studies, we know that there is a high likelihood of bias in the studies that have been done, given that people usually know whether they're smoking marijuana or not. Okay, so you can tell, you can unblind people, even if they're randomized to receive medical marijuana or not. So why should it be illegal? Why should, Jeff asked this important question, why should marijuana be illegal? Here it is in terms of, this is a study done by Consensus. These were 20 top experts. This has been replicated in 3 different continents, looking at the relative harms caused both to the individual user and to other people in the environment. So the social effects of different drugs. And here's cannabis right here, marijuana. So it ranks about middle. This one is alcohol. So when they looked at harm to the user and harm to other people, they found actually that alcohol was the most harmful, in large part because it's not just the person who suffers. Jeff made the point that from a libertarian perspective, if you're only harming yourself, then go ahead, right? You should just go ahead. But that person has loved ones. They may get into a car, of course, as well, intoxicated. That begins to then potentially have an impact on other people's lives. But it's hard to make the case that, well, it should be illegal based on the fact that it causes harm. We have drugs already, legal drugs like alcohol, which also cause harm. So what about arguments for legalization? So the arguments proponents would say, well, the war on drugs has failed. We're locking up way too many people. We have 25% of the world's prisoners, but only 5% of the world's population. We have about 2.5 million people locked up. 500,000 of those are there for drug offenses. We have huge racial disparities in the likelihood of someone being locked up for exactly the same crime in terms of drug possession. And therefore, legalization would reduce arrests and criminal justice costs. Demand is high, as Jeff already mentioned. So people are going to do it anyway, so why don't we just legalize it? And we can make it safe, too, because then we can control the quality of it. And it's not as bad as alcohol or tobacco. It may even be good for you because it's medicinal. And we could tax it and bring in revenue. And so what we have seen since the war on drugs was declared, of course, is a big increase in incarceration. Again, not all of those are drug offenses. About a quarter of those in prison are drug offenses. We've had overcrowding. Of course, this is a cafeteria in California, stacked high, triple high with beds. So, of the 2.5 million prisoners, the answer would be to legalize, right? If prohibition doesn't work, then maybe we should legalize it. So, as I mentioned, of the 2.5 million prisoners, however, only about 500,000 are there due to drug laws, and only about 40,000 are there nationally due to marijuana. So this would be actually justification for decriminalization, by the way, not legalization. Marijuana has been decriminalized in Massachusetts since 2008. But even so, to end the war on drugs by legalization of marijuana alone won't do it. What will happen is the 700,000 arrests that people are picked up for and arrested for marijuana, that will go down. That's for possession, okay? So 700,000 arrests for possession nationally. That will be eradicated, but we also have to think about what would be the arrest for violation of the new laws. Okay, so they're not zero. A question, of course, again, is how to legalize, as I've already mentioned. With industry involvement and commercialization, the economics suggest that to make this a viable commercial business requires targeting, advertising, investing in advertising to get heavy users. The alcohol industry relies on the heaviest users for the profits. 20% of the people consume 80% of the alcohol. So as Mark Kleiman, policy expert at UCLA says, you know, if the alcohol industry really wanted to promote responsible drinking, they really want to put themselves out of business. Because the majority of the profit comes from addicted, heavy users. I would argue that the same will be true of the commercial marijuana industry. So another aspect is if we make it more available and accessible, cheaper, which will happen under legalization, we remove the social stigma of it and legal penalties and have industry aggressively advertising it, use will increase. I would be shocked, I would bet my house on the fact that it will go up, okay? Jeff was making the case that somehow use will not go up. Possible marijuana could have a subtractive effect on alcohol use. This is a point Jeff didn't mention, but we don't know. In other words, would people swap out alcohol, and so the net effect of marijuana legalization and increased use would be nullified because people would be changing their preference for an intoxicating substance. Well, prohibition doesn't work. Everybody knows that, right? So legalize, regulate, tax, and educate. This would be the kind of the mantra. If I was promoting legalization, I would go for, we're going to legalize it, but we'll regulate it, and we can tax and get this income, and we can educate people to the harms so that they're informed consumers. This is a good libertarian view. Talk amongst yourselves for a second. I'll give you a topic. Marijuana. No, it isn't. Where was I? Here we are. So, of course, you all know the 21st Amendment repealed alcohol prohibition and virtually ended our alcohol problems. And we've been having a great party time since then. What's interesting, Jeff mentioned about the, there'd been no increase in use on via legalization, but when you look at actually the prevalence of alcohol and other drug use disorders in the general population, what we see is that for alcohol, which is a legal drug, we have 3.5 times more addiction cases in the population for alcohol than all illicit drugs combined. So you look at 12-month, this is alcohol, this is all illicit drugs combined. So this would be opioids, marijuana, cocaine, all the rest of it. And here's lifetime. So it seems like there's something going on in terms of prohibition, in terms of reducing cases of addiction, given that we know that drugs like marijuana, heroin, cocaine, methamphetamine do cause addiction. But in spite of the potency and actually the greater addictive potential of those drugs, we see a much higher rate of addiction for a legal drug. So did alcohol then, re-legalization, put an end to our alcohol problem? So this would be the case for marijuana, but somehow if we legalized it, then we would eradicate all the problems from prohibition. Well, we know, as I've already mentioned, alcohol is an addictive drug, right? Causes addiction. The majority of addicted individuals in the US who have an addiction problem are addicted to alcohol, okay? Alcohol is also a level 1 carcinogen. It's known to cause cancer. We know that in addition to roughly the 17 million people who are addicted to alcohol, out of the 22 million who suffer from an addiction problem, in addition to that, there's another 40 million people who drink at harmful and hazardous levels. We have 100,000 deaths a year. It's the third leading cause of preventable death. We have lots of road accidents. We have a burden economically of about $250 billion a year from alcohol. And the sales tax revenue is about $15 billion, okay? So 10 to 15, factor of 10 to 15 discrepancy there in terms of what we're paying, the price tag we're paying, and what we bring in tax revenue. And in terms of, I mentioned about what we would do with marijuana legalization is that we would remove the 700,000 or so arrests each year for possession. But don't forget, we'd still have to enforce the new laws. Underage sales, use, intoxication, drug driving. We have to pay for that. In fact, with alcohol, even though alcohol reintroduction, the end of prohibition, was supposed to reduce and eradicate the crime, we have 3 million arrests a year for alcohol violation of the alcohol laws. So if prohibition doesn't work, it's hard to make the case that legalization is the solution. So here's a question. If the majority of people in the country who are addicted to some drug are addicted to alcohol, why don't we have alcohol may cause addiction on the outside of alcohol containers? Ever thought about that? Why don't we have that? Warning, alcohol may cause addiction. I was over in London recently, I picked up a packet of pills. There were migraine pills. has codeine in it, says right on the box, may cause addiction. Okay, alcohol causes much more addiction than codeine, okay, in terms of the number of people addicted. But why don't we have it on the thing? We know that alcohol is a level 1 carcinogen. It's in the same category as asbestos. Why doesn't we have on the container, this is known to cause cancer? Part of the reason are these guys, okay? Industry specialists and lobbyists. This is the case, actually, of the tobacco industry. Do you remember seeing this? We swear that tobacco is not addictive. There's no good evidence that tobacco causes cancer. Yes, I'm telling the truth, the whole truth, and nothing but the truth. So what do we know about a psychoactive substance like marijuana? I would argue that this is not just another product. This is no ordinary commodity. We're not talking about Rice Krispies here in terms of people using it. In fact, what we know is that substances like marijuana cause harm through 3 different pathways. Okay? They're related but distinct. The one that we often think about is addiction. Okay? Is it addictive? Some people say, well, marijuana is not addictive. Doesn't cause addiction. It does cause addiction. I'll talk about that. But even when it doesn't cause addiction, you don't succumb to addiction, of course, you can still get intoxicated and get into a car and crash your car. Okay, you don't have to be addicted for that to happen. We see this every day with alcohol. We will see this increase. We have seen it increase in states where it's been legalized. What about toxicity? That's another pathway through which substances cause harm. When we talk about toxicity, for alcohol, for example, that would be liver disease. Okay? Alcoholic liver disease is a toxic effect. You don't have to be addicted to get liver cirrhosis, actually. In fact, half of liver cirrhosis patients are not addicted to alcohol. They've just been using steadily over many years, and their liver becomes impaired and diseased. What we're talking about with toxic effects related to marijuana is neurotoxicity. This is the primary negative effect, particularly for young people. We're seeing this in young people's brains. So what about addiction? Is marijuana addictive? Yes, it is addictive. We know that roughly 10% of people exposed to marijuana will become addicted. For those who start during their teen years, it's about 17% will become addicted. And for those who are daily users, heavy daily users, be about 38%. So does it cause addiction, the syndrome of addiction? Yes, it does. In fact, when we look at national data, we can see that, as I mentioned, it's a popular drug, although it's mostly, of course, illicit. This is the most used drug among people who are starting to use any drug. In terms of addiction cases, it's by far the biggest illicit drug. Alcohol would be bigger, but you can see pain relievers and heroin are much smaller. And these are treatment cases. So this is the primary drug that was reported at treatment entry around the country. Alcohol, I mentioned, was the biggest, of course. Look at marijuana, that's the second biggest. So even though people would argue it doesn't cause addiction, many people are seeking addiction treatment for it. We've also seen an increase, doubling actually, in the rates of marijuana use disorder in the last 10 years. And these are national data. What about toxicity-related effects? This is a study, this is a quantitative, systematic review on the effects on adults. This is a well-done, rigorously conducted study looking at the neurocognitive deficits of functioning. What they found in people who were smoking marijuana was that there were definite neurocognitive deficits when you measure on sensitive executive functioning tests. Early during abstinence. But what's interesting is that in the studies where they allowed people to, there was a period of abstinence, after 25 days of abstinence, they showed in adults that there was no residual impairment. So this is good news for adults who are using marijuana, perhaps, at least at the potency they were using. We don't know about the newer potency in the edibles. They may have neurotoxic effects even for adults. But what about young people? We know that there are certain critical periods of development where the human brain is more susceptible to certain insults than others. One of them is during adolescence. We know the brain develops from the inside out, from back to front. And it turns out that the adolescent brain is particularly susceptible to the impacts of marijuana. And this is a study showing the impact of marijuana on memory. And in this study, these were done by colleagues at my lab, marijuana users, particularly early onset. So this was those who'd used prior to age 16, showed impairment in learning relative to non-users. What happens in abstinence in young people? Some people report that they use marijuana to help them with their mood. When they're actually paid not to use, so you can actually induce a period of abstinence, what we find is that depression lifts. Actually, people feel better when they're abstinent. And also, cognitive capacity increases also with abstinence. This is the best, strongest longitudinal study that we have right now. It was 1,100 people followed up for 25 years from age 13 up through age 38. And it was done in New Zealand, and they were recruited before they were exposed to any alcohol or marijuana. So they had no history, no exposure at age 13, and they were measured on their neurocognitive functioning, okay, prior to any use. And then they followed them up for 25 years and kept on measuring neurocognitive functioning and their marijuana use, alcohol use, cigarette use, other kinds of behaviors, because they wanted to look at all the health trajectories of this cohort over time. What they found was that those who used marijuana heavily before the age of 18 showed a drop in IQ of 8 points that they never got back, attributable to marijuana. So 8 points in IQ doesn't sound very much, but that's the equivalent of going from the 50th percentile to the 29th percentile. So that's a big drop in terms of percentile ranking. What was also interesting about the group, this group who had used during their teenage years, it wasn't shown in adults, was that other people in the environment, they were also studied, and they were asked, do you notice any attention deficits or memory impairments in your significant other, your loved one? And only those who had used during the teenage years showed demonstrated observable deficits in attention and memory, so much so that other people noticed it. They didn't know it was related to marijuana use, but they noticed these deficits in attention and memory. And by the way, it was apparent even if they quit for a year or more. Even if they were abstinent for a year or more, they still had these deficits. Now, the other thing to remember is in that cohort, the potency of marijuana was much, much lower than it is today. Okay? It's reckoned to be about 4 to 5-fold what it was back then. We're also understanding exactly how cannabis affects the developing brain. We understand now much better about its effects on glutamate and pruning in the prefrontal cortex and all the other pathways that are associated. So we understand now the mechanism by which these cognitive brain insults occur during early exposure. This is important when we think about marijuana legalization. Now, if you take Colorado, the latest report just came out last month. Again, it has a legal age of use of 21 years or older, just released the report. Even though marijuana use in the nation has gone down 4% in 13 and 14, it went up 20% among adolescents in Colorado after legalization. In fact, when we look nationally, we see a moderate to strong inverse correlation between legalization and adolescent perceptions of harm related to marijuana and use of marijuana. You can see the states where it's legalized. You can see the states where it's medicalized. Okay, look at these. These are the states where perceptions of risk of great harm from smoking marijuana once a month among youth 12 to 17, it's strongly correlated. So where there's legalization and medicalization, adolescents are more likely to think it's harmless, okay? And they're more likely to use it. You see exactly the same pattern in terms of use, of underage use. You see double the rates in states of underage use in states where it's medicalized or legalized. What about schizophrenia? So this is another important topic. We know that for a long time, this has been known for a long time, there's a correlation between cannabis use and schizophrenia, psychosis. If you use heavy amounts of marijuana, it makes you paranoid. Right? That's a psychotic. Paranoia is a psychotic symptom. It produces actual psychotic symptoms. That doesn't necessarily mean schizophrenia, but interestingly, in many studies, early use and exposure to marijuana is associated with psychotic symptoms and schizophrenia. It roughly doubles the risk. Where it exponentiates the risk is potentially among genetically vulnerable individuals who have certain genotypes. In this sample, for example, those with a particular gene only who were exposed to marijuana had a 7-fold higher odds of developing schizophrenia relative to those who did not have this particular gene. So again, like many other kinds of vulnerabilities that we may encounter, may manifest in terms of disease, progression, onset, exposure to marijuana may trigger turn-on genes that may not otherwise be turned on. This was a replication, again, of that same study. So it's what we call an epigenetic effect. So when you have an exposure to an environmental risk, in this case cannabis, it can turn on genes which would not ordinarily be turned on. And it was brought to my attention a case recently of a 17-year-old who, in a family with no history of psychosis, has now very florid psychotic symptoms after only fairly minimal exposure to high-potency marijuana. The other thing I think we need to be very wary of are edibles. So these are higher concentrations of marijuana, the psychoactive ingredient of THC, available in these rather cute and attractive looking gummy, these aren't gummy bears, but they're gummy X, whatever they are. Potential for, of course, inappropriate use by younger people who might find them attractive, including infants. And in fact, we've seen increases in marijuana poisoning that weren't apparent before. We're seeing increases in infants being brought to emergency rooms after imbibing marijuana, good-looking marijuana candies. Okay. So just to, the other thing to note is that we are seeing increases in Washington State in terms of increase to visits to emergency rooms since it's been legalized. So what about intoxication? The main thing with intoxication with cannabis, every drug has its profile of consequences. Marijuana roughly doubles the risk of having a motor vehicle accident. It's not as high as alcohol, but it doubles the risk. Are people smoking marijuana and driving? Yes, they are. This is a survey, online survey done in Colorado. Marijuana found that roughly 44% had reported driving within 1 hour in this sample of smoking marijuana, and marijuana 5 times in the past month, 24%. So you can see the increase. This is actually fatal motor vehicle accidents since commercialization of medical marijuana, of recreational marijuana in Colorado. These show, again, similar increases. Particularly vulnerable in terms of smoking and driving or imbibing marijuana and driving are young people. So disproportionately, these are the 16 to 25-year-olds and 26 to 35. So it's the most impulsive, inexperienced drivers who are most likely to be using marijuana, which could exponentiate risk. So in terms of a summary of what I've talked about tonight, there are potential pros of legalization in terms of what would we get rid of if we legalized marijuana. We would improve the quality control so people would know what they're getting. Eradication of arrests due to possession, but of course, if 21 years old, decriminalization already does this in terms of possession, simple possession. There will be minimization or eradication of the black market if we legalized it, and we bring in tax revenue. So the potential cons would be obviously public health and safety harms, as I've alluded to. I'd be absolutely shocked if consumption will increase. Like I said, I bet my house that it will go up. We just don't know by how much. Addiction rates may increase. The overall number, of course, of addiction cases will go up. Proportionately, it may go up too. It's roughly 1 in 10 who are exposed. But with higher potency formulations, we may actually see increase in proportion of addiction cases. We would see toxicity-related poisoning and neurocognitive deficits, particularly among adolescents. We've already seen this go up in Colorado as a result of, even though it's illegal, it's very hard to regulate that. And as I mentioned, and the other thing is productivity may go down in terms of missing work or underperforming due to higher rates of use. And that is the biggest contributor to the economic costs of any drug. So as I mentioned, there seems to be a sweet spot in terms of public health, which is decriminalization and potentially even legalization, but not with commercialization. This is where we are with question 4. Unmitigated commercialization, just like alcohol. And alcohol's been such a success, we want to replicate it now with marijuana in exactly the same way as the great public health positive benefits we've had from doing that with alcohol. So there I'll end. Thank you.
Okay, so we have 2 Harvard professors with very different opinions about exactly what to do about this particular question. So I hope, because I think that there are studies on each side, I hope that we won't sort of get into debating the research methodology or anything like that necessarily, but I think instead, we will talk about some of the issues that have come up in each of the presentations that you just heard. Again, if you have a question and you would like to write it down, let folks know in the audience, and they'll bring those questions up on a piece of paper. And if you would like to ask a question, you feel free to raise your hand, and I can bring the mic over to you. But first, I would just like to let Jeff respond a little bit to some of these things. And I think basically, the overall question to me about this, and certainly after seeing John's presentation, is why do we need another psychoactive substance, or why should we have another psychoactive substance on the market?
So I would answer that. And why do we need another psychoactive substance? First response is we have that psychoactive substance. It's out there. It's traded in the black market. Almost everybody who wants access to it already has access to it. So we're not creating something which is not already in the marketplace. Secondly, by trying to control it, we generate lots of adverse side effects. And John is entirely right that legalization doesn't eliminate all the harms that can occur. The question is whether legalization increases or decreases those harms. And the claim for legalization is that many of the harms, due to the black market in particular, crime, corruption, violence, quality control, that those are eliminated without exacerbating sort of the other things which inevitably will occur sometimes. Some people will drive under the influence, as alcohol or with marijuana, or antihistamines for that matter. Finally, I think to a libertarian, it's sort of frightening that the question is, the burden of proof is on us to prove that people should be allowed to do what they want. We think the burden of proof should be on people who want to restrict freedoms, restrict the ability to consume whatever you want, whether it's intoxicating or not, psychoactive or not, okay, burden of proof should be on them to prove that there's some great harm done and that the benefit of prohibiting it exceeds the harm of prohibiting it. And we don't think any of that is true in this case.
But what about John's point? Look at what's happened with alcohol.
He's comparing apples and oranges. A lot more people are interested in consuming alcohol. One of the reasons that some things are prohibited and others are not is that only minorities of the population seem to be interested in certain substances, and so the majority votes to keep legal the things that the majority likes, and it votes to outlaw in ways that correlate strongly with racist attitudes throughout U.S. history, the things that are associated with minorities that the majority doesn't care about as much and doesn't care about the substance as much.
And I just have one question for John, and then I'm going to open it up to you. And John, I'm just wondering if you could just respond to that a little bit. Why the substance is here? Why not regulate it? And why not have a botanist sort of make sure, or a scientist make sure that there is quality control as opposed to a drug cartel?
I've got a mic here actually, so I can use my hands and talk. It's pretty because I've still got my lapel mic on, so I have an advantage. Yeah. So what was the question again? It was why don't we? Why can't?
Why is it? Is it government overreach almost? Why are you telling folks to
right.
use a substance that's already here?
Right. So it's already here. So why don't we just legalize it and then control it and regulate the quality? That's a pretty good argument. The counter argument is that it depends on, as I mentioned, which policy position you might want to take. So it's not just, think about it. Is it just, do we have to have just commercialized legalization like alcohol? And there's no other option? No, right? There are different ways even of legalizing things. That's what that graph shows, is that, wait a minute, okay, well, perhaps ballot question 4 is not put the right way. Jeff even mentioned it at the beginning of his talk. Maybe that's not the optimal way to legalize a drug. Maybe there is even another way to do it where you could actually eradicate the black market and minimize any public health harms, right? We've tried to do this through decriminalization. Since 2008, it's been decriminalized in Massachusetts. And there are certain other policy positions. It's not question 4. Question 4 would be the worst possible thing you could do in legalizing a psychoactive drug, which is known to cause addiction, neurotoxicity in adolescents. It will increase use among adolescents. It can cause psychosis, and it causes intoxication, which can lead to more motor vehicle accidents. We've already seen that in Colorado and Washington State. So there are different positions. Even the libertarian view, John Stuart Mill, who I'm sure Jeff is very familiar with, argued against. I mean, one thought that is put forward is, should you have the liberty, should you have the freedom to sell yourself into everlasting slavery? Should people be allowed to give up their liberty forever? Should that be a freedom also? I can tell you that when people take drugs, they don't believe that they're going to become addicted. And we're told by advocates of marijuana legalization is that marijuana is not addictive. It doesn't really do any harm. But most people who start using a psychoactive drug have no idea what they're getting into. Not everybody becomes addicted, like I said. 10% of people overall, 16% among adolescent users, 33% among regular users. These are very high proportions of people that are really essentially, if you take the word addiction, which is actually to be enslaved, that's what it means, to be enslaved, then individuals really are selling themselves into slavery they're giving up their right to liberty. And John Stuart Mill argued that should not be the case. You cannot give up your right for liberty. That should not be your own decision. There will be something maladaptive about that libertarian decision.
We have an interesting question from the audience here. Do either of the presenters receive any commercial benefits for their research or their presentations?
I'm on the staff of the Cato Institute, so I get a salary from them. It's not specifically related to my positions or to this appearance or this paper, but yes, if you consider that a conflict of interest, then I have that conflict.
I don't have any conflicts of interest, no.
Another question. What do we know about marijuana use and opioids? John, I think you would probably be the person to answer this question. Do we know if there's a connection with marijuana and opioids, particularly because we have an opioid epidemic? This is a question from the audience.
In terms of one being a gateway drug, is this the question?
That's right.
Is this the, okay. So we know that historically, when we look at studies, marijuana use is a predictor. It's a risk factor for other drug use. We don't know exactly what the causal mechanism is for that. It doesn't mean that everybody who uses marijuana, of course, is go on to use methamphetamine and opioids. A minority of individuals who use marijuana will go on to use other drugs. Now, we do not know the causal pathway through which that may happen. Whether, for example, there is a direct causal link, something happens in the brain via exposure to cannabis, and that produces somehow a change in the brain which requires a greater potency of some substance, which marijuana doesn't work after a while, so they have to get a higher potency drug. Or it could be an indirect pathway via people associating with other people who are using other drugs, and therefore they get exposed to those other drugs, tempted to try them, and they just happen to just be exposed by virtue of an indirect method.
Yes, I'd like to respond to that. There is a recent study which concluded very strongly that the introduction of medical marijuana laws in various states over the last 20 years was a significant factor in reducing the number of deaths from opioids. That is, they appeared to be substitutes, and so when people had more access to marijuana, they were less likely to go to the black market, consume opioids in a way which led to overdoses. So again, there was a beneficial impact of giving people greater access to marijuana.
Can I just say about that? In terms of causality, we have no idea whether that's a causal connection or not. That's just a correlation. There are many things which are correlated. As Jeff rightly pointed out in his talk, that what Jeff alluded to is what we'd like to write in the discussion section of papers that show correlations, is we want to infer a causation from a correlation. Okay? Just because there's a correlation, but it could be another variable which accounts for both. And Jeff knows this well. Jeff's not stupid, he's a Harvard professor. And you don't make inferences, although we would like to, depending on your own bias and what you're trying to do in your study. But you have to be very careful about causal connections between correlations in epidemiological studies like that.
I couldn't agree more, and that affects the interpretation of every single study that John cited. None or almost none of those studies was an experiment. They were all observational, correlational studies, epidemiological studies. So the fact that you can't draw causal conclusions from correlational studies applies to almost all medical and social science research. The possible exception is if you think that a particular state has adopted a law, such as a medical marijuana law, for reasons other than its anticipations of the future path of the opioid epidemic. So if you think that the states which were about to see the relatively slow increases in opioid deaths sort of knew that, and that's why they adopted medical marijuana law, then you could believe that the study I cited was not a causal effect, was just a correlation. That's possible. It doesn't seem especially likely. But regardless of what you want to think about the study I described, it applies to every single other study that was cited in John's talk.
I just want to say, yes. I know I did tell people they could raise their hands, so.
For Dr. Miron, legalizing marijuana will make it more available, I believe, to young people because it'll be around the house. Teenagers particularly are notorious for getting into their father's and mother's liquor. What control do you have? What study do you have, if you have one? And what way would you control children from getting their hands on this, perhaps at a very early age, as was shown that it was very dangerous for younger children to have it? I don't think there's any disagreement on that. And will this law then make children more damaged and more likely to use it?
So it's absolutely right that laws cannot prevent kids from getting access to the ibuprofen that's in most people's medicine cabinets, which will kill you if you take more than a certain number of pills, getting access to alcohol or cigarettes or knives or some households' guns and so on and so forth. So if you think that parents are widely sufficiently irresponsible that they're going to make it easy for the children to get access to dangerous substance, then we're in big, big trouble. Okay? The fact is that, one, the vast majority of teenagers know exactly where to go in their junior high school and high school to buy marijuana. Okay? I've asked my kids, I've asked random samples of lots of kids, systematic surveys done by the Monitoring the Future survey say that kids have an easier time, think it's more available to get marijuana than alcohol. And that makes sense. The people who sell alcohol, okay, know that they're subject to these only selling to 21 and over, so they have some tendency to avoid selling to under 21 because they would pay a penalty, they would lose their businesses or get fined. The black market sellers of marijuana face no incentive not to sell to teenagers, okay, so we have no ability to regulate it, to nudge it in the right direction. So yes, of course it's a risk, but the risk is already there, and making it legal, if anything, makes it a little bit easier to nudge household sellers into making it less available to their kids.
I think we've also seen, in Colorado, since legalization, an increase in underage use, 20% increase in adolescent use. So when you decrease perceptions of a drug's harm via legalization, it looks like it also correlates, again, correlation may not be causative, but it correlates with higher use among adolescents. So, and to the extent that a drug causes harm, we will see more degrees of harm.
We have actually two audience questions that are somewhat related on that I'd like to bring up right now because it's about the youth use. One question for Dr. Kelly. It says, isn't it true that the number of teen use in Colorado went up because children who were from other states were going there to use marijuana? This is their question. And also, on the other hand, could that 20% number be completely inaccurate because it's already underground now? Is that an underestimate?
I don't know. It couldn't be accounted for by kids coming from other states that are factored into that statistic because that's done from high school survey data. But in terms of its accuracy, these surveys are looked at and scrutinized for accuracy, of course. So to the extent that any survey anywhere is susceptible to some kind of reporting bias, that always is a factor in any measurement of anything. But I don't think it doesn't. I think most people who understand survey design and statistics, I don't think there's any reason to suspect that this is particularly susceptible to bias in any way.
Can I ask what the data source is that shows a 20% increase in teen use in Colorado? Which data set is that from?
It is from the Colorado. I think I have it. I think I have it on my slide actually. But it's from the monitoring body, which is monitoring the impact of legalization in Colorado.
So I think that there is a clear potential for bias in self-reported data on use of a substance like marijuana when it goes from being illegal to being legal, which is that people are going to tend to understate, and it's well documented based on corroborating their responses with objective things like urine tests, that people understate their use of an illegal substance. When the legality changes, you might think the number of people who are willing to say, yes, I use that substance goes up, and that would explain perfectly why you would get at least some increase in the reported use of marijuana amongst teenagers when the law changed.
I want to just ask a question that I want to follow up on something that June said when we started, and that was about money. That $2.5 million, and you can correct me if I jotted these down wrong, was spent by the folks who are supporting. Question 4, yeah, 126,000 spent by those opposing. And oftentimes, in covering this story, I've heard folks say that the people who are proposing this are more concerned with profits for the marijuana industry than they are with the public safety of the state of Massachusetts. So, Jeff, I think that that would be a question for you to answer.
So I believe the numbers, and I don't deny for a second that some people trying to legalize marijuana are interested in making profits. There's absolutely nothing wrong with people wanting to sell a good once it becomes legal and make profits. I'm sure lots of people in this room do that every day. Secondly, I think looking at the official numbers on the contributions or spending is extremely misleading. The side that's trying to keep the law the way it is has the advantage of having the governor and the mayor and the head of the legislature all basically on taxpayer dollars making the case to keep the law the way it is day after day after day and getting tons of free airtime to do so.
Question from the audience here. This is about marijuana and driving. How do we test for driving under the influence of marijuana? Do we have a standard right now? John?
No, we don't have it. In terms of measuring impairment?
Measuring impairment.
There have been standards proposed in terms of a certain threshold, 5 micrograms, I think, per deciliter, as a standard. But we don't have a way of measuring that well other than via a blood test. So doing roadside testing is currently infeasible, so that makes it very difficult to do that other than when someone has an accident to obtain the emergency room or in a hospital or a police station to obtain a blood sample. So we don't have good ways of getting at that currently. But what we are seeing is increased motor vehicle accidents as a result of drugged driving from marijuana and also fatalities.
And actually, also, just a follow-up question from the audience. Do we know, what do we know about deaths caused by marijuana compared with deaths caused by alcohol, either in accidents or not?
So it's absolutely right that it's difficult to test for marijuana use in the context of driving under the influence, not just the logistics of doing a blood test at roadside, but because the amount of THC in your system can last for a week, even 2 or 3 weeks. So the mere fact that you test positive is only a very weak indication of impairment. So that makes it messy for sure. Okay. That said, there are a bunch of studies, a bunch of cases where places have changed either their alcohol laws or their marijuana laws, and we've been able to observe what happened subsequently to the rate of traffic fatalities. So I'm very puzzled at John's statement that in Colorado traffic fatalities went up, because that's in the study that I mentioned in my talk. I have a bunch of copies up here. You're welcome to come look at it. It looks precisely at the rate of traffic fatalities in Colorado and the other states, and the first order effect is no change. In the studies where there was a change in the relative ease or access or price of alcohol relative to marijuana, making marijuana more available led to lower traffic fatalities, apparently because people substituted from alcohol to marijuana. And even though marijuana does impair, and you clearly shouldn't drive under the influence of marijuana, the impairment is less than the impairment of alcohol. So when people substituted from alcohol to marijuana, traffic safety improved, okay, rather than getting worse.
The data I showed actually are from the Traffic Safety Commission in Washington State and in Colorado, and so I can give you the references, or you can look up those reports yourself. They do show increases in drug driving and in fatalities related to marijuana. As you saw on those graphs, since legalization, the increase in drug driving and also fatalities related to marijuana. So perhaps there's a difference in the reporting. There's a potential definitely for reporting biases because of what's at stake. You know, when you have big industry potentially losing a lot of money by not getting this passed, there is a potential for reporting bias both ways. both ways, both in terms of prohibition and legalization. There's both potential for bias. So I'd encourage people, take a look. I'm happy to share my slides, give you the citations. You can look at the official reports. And I'd like to look at Jeff's report as well.
That slide showed the fraction of people in these accidents who were testing positive for marijuana. It didn't show the number of accidents.
It did, yeah. It has fatalities as well. Yeah.
Well,
I can show you afterwards.
Okay.
we'll resolve
You can
it
see
later.
the reports.
There are different studies, but we do have another question from the audience. And again, raise your hand. I'll let you
I
know.
can send you the reports.
Hi. This is a question for Mr. Kelly. You talked about marijuana having effects on people with schizophrenia, and I was just wondering if there was a way to genetically test your family to see if you could be affected by marijuana in those ways.
Like a pretest to see if it would affect you.
Yeah, again, these are two studies. We have to be careful about replicating studies. This is why it's important for consistency and coherence in studies. You have to have consistent results, not just one or two studies. But there would be a way with testing, genetic testing, so you could identify those who have that particular genotype and maybe go out of your way to try and protect them from exposure to marijuana. But just because you may not have the genotype, of course, does not mean that you wouldn't potentially incur other kinds of harms like addiction. But you might reduce the risk for schizophrenia.
Another question?
For Dr. Miron, I'm wondering if you have or if you do use marijuana yourself, and if you have children, what do they or how are they affected by all this? I'd like to hear more about children and how it affects them. It isn't just accidents on the highway when they get older. There are serious, serious consequences for the entire family. But I want to know how many people, are here are familiar or have taken it. Have you taken it so that you know the effects of it? Or have family members who know?
I engaged, along with President Obama and more or less every other person we can think of who's talked about the issue in youthful experimentation. I haven't touched it in 35 or 40 years. I had some vague impression of what the effects are from those experiences in college. I told my kids that I could care less whether they smoked marijuana or not if it were legal. If it were still illegal, I thought it was a bad idea because if you do get caught, even though the likelihood of that is low, in the wrong circumstance, you can get an arrest record, okay? Or you can get disqualified for taking out federal student loans and things like that. So I certainly told them about the potential negative consequences from prohibition and smoking marijuana, but I told them it was none of my business. I mean, this is once they're 18 and over. I'm not talking about when they're 15. So at least I put my money where my mouth is. My attitude with respect to my children's use is the same as what I've been describing. The risks, as best I can tell from reading the literature, are very, very small. I also talk to my kids about their friends. And my kids say, yeah, there know lots of people who use, lots of people who sell in their high school, and even their junior high school. They said in their experience, there were two groups. There were people who were sort of unpleasant stoners. And they had been unpleasant people since they were in the second grade, long before they were stoners. And there are people who were really good students, okay, who also smoked marijuana and ended up going to Harvard and Yale and Duke and Stanford and so on and so forth. And so they perceived no correlation between the use of marijuana and any causal effect of the use of marijuana or any particular adverse effect. Because some people who used it were successful and some people who used it were not, but it didn't relate to whether they used.
Another question. I think we'll be able to maybe take one or two more, and each of our presenters maybe a minute to sum up.
Thank you. I just wanted to comment that Mr. Kelly, Dr. Kelly, You mentioned that there's no studies about, or that we don't know what the consequences are going to be to unborn children. I'm not sure if you're aware of this, but there is a 40-year study in Jamaica on the effects of cannabis on unborn children. And they found that perhaps those children may even be healthier. So I just wanted to inform you of that study so that you don't have to say that anymore.
That I don't have to say that
we don't have any studies.
Oh.
She's saying there is a study.
I'm not sure exactly what you're talking about. Maybe I missed something, but the effects on unborn, the effects of marijuana on unborn children. It actually makes them healthier. Okay. Well, do you know there was a study that came out as well? Again, this is a correlational study, which showed that women who drank alcohol during pregnancy. I'm true.
Alcohol is completely different. It's dangerous. Cannabis has never hurt anyone, ever.
I think the point I was trying to make was that you have to be careful of correlational studies, as I've already mentioned. We see it makes great newspaper headlines. There was a very similar study. It reminded me of it, and this is why I'm saying it, because we know it's a fact that alcohol consumption during pregnancy can cause fetal alcohol spectrum disorder among unborn children, and that's devastating for their whole life. And there was a report in newspapers because of a correlational study which suggested that actually drinking alcohol during pregnancy had kids that were smarter and more well-behaved. Okay? Again, a correlation, but inferring a causal connection that somehow, if you drink alcohol when you're pregnant, your kids are going to be smarter and more well-behaved. Now, that's a correlational study, but a very dangerous inference made from a correlational study. Now, I don't know the study that you're talking about. I would have to take a look at it and see the nature of the study and how good the evidence is. If the evidence is such that it actually does suggest that smoking marijuana during pregnancy does cause kids to be smarter, then that would be great news, right? Because then we could encourage pregnant women to smoke marijuana, and our offspring in society would all be better off. So that would be great.
Same kind of science that cigarettes gave us. It was paid for by lobbyists, and it's full. You're lying to people, and we're not going to put up with it. We're going to catch you in your lies, and we're going to tell people that you're lying to the public. You know who I am because we've had these conversations before.
Okay. So there are different studies, and we'll agree on that. But we're not going to call anyone names or accuse them of doing anything. I believe that both people are here and believe what they're saying and are doing it in their because they agree with it and it's in their best interest. So let's go on, because I think a lot of these questions have to deal with regulation, whether we're talking about effects on children or effects on driving, or and we have several questions from the audience here. How can we be reassured that people aren't going to work while they're high and putting others at risk? Why wouldn't this be available only by prescription? Where would the tax revenue go specifically? So there are lots of questions about how do we regulate this, and we know that the ballot question calls for a Cannabis Control Commission. And Jeff, I think the question goes to you. Will that commission, is that sufficient to regulate some of these issues and to make sure that this is handled properly?
So I probably don't put much faith in a commission or various other kinds of regulation to control the misuses. There, of course, will still be misuses if it's legal, just as there are misuses now when it's illegal. People can be buying on the black market and going to work stoned. But I think my observation of human nature and of the more systematic evidence, subject to all the various caveats, is the vast majority of people don't do these irresponsible things, or at least not very often, that private groups have mechanisms for protecting themselves. against these adverse effects. People who have workplaces where it might be dangerous, they test their employees. Airlines test pilots for drinking and for drugs. Actually, they test them more for drugs than for alcohol. Well, it probably should be the reverse because alcohol use is much more common. And so I don't want to say the Commission is going to address all these issues. I think that people being responsible parents, employers, etc., teachers, coaches, will do a very good job, and they'll be able to do a better job if it's legal and less hidden, so that there's not as much secrecy about who's actually doing it and who's not.
And John, your thoughts on the Commission and regulation?
Again, I mean, I think it's not just a matter of. I think the Commission and regulation seems to be overburdened towards industry representatives, from what I understand. So that seems not in the interests of public health and safety, but rather in the interests of profit.
We are just about out of time. I'd like to give each of you 1 minute to summarize, if you wouldn't mind. And since, John, you answered the last question, Jeff, I'm going to let you go first.
So I guess I would say, to close, think many of the claims one hears against legalization, if accurate, would suggest that we were already living in a country where people were dying of traffic accidents related to marijuana right, left, and center, where airplanes were crashing because of pilots, where all sorts of horrific things were happening. If we believe the claims of many of the vocal critics, we should have seen marijuana use skyrocket in Denver, all these other sorts of things. That clearly is not right. Colorado, for example, took a poll just a week or two ago about whether people wanted to prohibit it, and the result was basically very similar to the balloting in favor of legalizing it. A strong majority wanted to keep it with its current status. It doesn't seem likely to be true if all these horrific effects that are alleged were even remotely accurate. So I think that just common sense and looking around and seeing the experience with what other states have done and what other countries have done suggests that the balance of benefits and cost is strongly in favor of legalization.
John?
Thank you, I mean, obviously, this it arouses a lot of passion, and we all have our different viewpoints and histories coming to this very important issue. And I'm not against legalization per se. I am against the way that it's being proposed in question 4. As I mentioned, there are different policy positions. I'm all in favor of debate and discussion around the best policy position that will serve our society the best. That's what I would like to see a discussion of, not a law written by commercial interests and going to be overseen by commercial interests for the benefit of our society. That doesn't seem correct for me, even though I think we could have a broader discussion about different policy positions, including legalization without commercialization. That could actually be a way to get rid of the black market, eradicate criminalization, and reduce the public health harms. But that's not question 4. So I would just argue that we need to think a little bit more deeply about what we're doing as a society. Again, not necessarily even against legalization, but how we might actually eradicate the drug problem harms or minimize them. What we're going to do right now is just change their nature and shape. We will eradicate some of the black market problems, and we will introduce some of the public health, as we saw on that through commercialization, some of the public health harms.
Okay, we're going to give the last word to June as well. She was the first speaker, she'll be our last speaker.
I'm thrilled to see how many people turned out today, and I hope you will all tell your friends and neighbors what you learned here tonight. Read this. Try to answer some of the questions that didn't get answered tonight, and don't forget to vote on November 8th.
Thank you all for coming. Thanks to our panelists. I hope you learned something tonight. Thank you.